Opioid addiction is plateauing, but the crisis isn't over. It's from the Los Angeles Times. New data from the Blue Cross Blue Shield Association suggests opioid addiction rates are finally plateauing, but that doesn't necessarily mean overdose deaths will drop anytime soon. It's a sobering reminder of just how long it might take America to get through the ongoing crisis. The big finding from the BCBSA data, which compiles medical claim information from the various Blue Cross affiliates across the United States, diagnosis of opioid use disorder, addiction in other words, declined from 2016 to 2017 from 6.2 per 1,000 to 5.9 per 1,000 patients. It was the first decline the BCBSA had measured in 8 years since it started tracking opioid use disorder diagnosis. It also comports with other national data sets we've seen recently. The data from the BCBS is certainly good news and promising, Eleanor Artigiani, the Deputy Director for Policy at the University of Maryland Center for Substance Abuse Research, told me. The Blue Cross data indicated that efforts to curb overprescribing are having the desired effect. Opioid prescriptions have dropped by nearly 30% from 2013 to 2017. Two-thirds of opioid prescriptions filled in 2017 with the Centers for Disease Control and Prevention's recommended guidelines. It means that there's light at the end of the tunnel. Andrew Culloden, co-director of the Opioid Policy Research Collaborative at Brandeis University, told me. The decrease in new cases of opioid addiction is likely due to the trend in more cautious prescribing and greater public awareness of opioid risk. But this data doesn't mean that the opioid crisis is winding down just yet. Overdose deaths reached new highs in 2016 when more than 60,000 people died of drug overdoses, most of them from opioids. Millions of Americans are still living with opioid addiction. More powerful synthetic opioids like fentanyl have made the risk of just one relapse even deadlier. The genie is out of the bottle, Culloden said. Unless we do a better job of increasing access to effective treatment, overdose deaths will remain at record high levels. And we'll have to wait for this generation to die off before the crisis comes to an end. We said the exact same thing about the crack epidemic back in the 1980s. Congress is looking at some new steps to improve access to addiction recovery, such as allowing doctors to prescribe medication-assisted treatments to more patients. But lawmakers have yet to make the kind of financial investment experts think is necessary to fight the crisis. So the BCBSA data is good news with ample caveats. We do seem to be getting better at preventing overprescribing, and addiction rates do seem to be stagnating. Nevertheless, we need to do a lot more if we are to stop setting new records every year for overdose deaths. Maureen Boyle, a former researcher at the National Institute on Drug Abuse, who now works at the Addiction Policy Forum, summed up these contradictions like this. One concern is that this will make all of public health efforts of the last few years seem like they have failed, when actually they have shown success and have likely slowed the increase in overdose deaths. But controlling the supply of synthetics is probably impossible, given the incredibly small volumes that need to get across the border. I just hope policymakers don't get disheartened by the raw numbers. That's what I said. It's a very, very small amount that needs to make it through. So they might get 99% of the volume coming across the border. You might get interdict 99% of it, but it only takes one. If you get 1 kilogram, that's all it takes. This sums up everything that I've said. And what's frightening is that they said this crisis may not embed itself until the actual users die off. And some of these users are millennials. So can you imagine this crisis going on? I think the crack epidemic went on 15 years, depending on the intensity. But the thing is, it didn't die out until like 1995 or 1996. Imagine if you get an opioid crisis that goes on this long. that peaks, because I think the crack epidemic peaked in like 1989 or 90 and then started to fall off. If this is peak, then they got another 5 or 6 years of this stuff. And with the widening scope of this stuff going into the larger population as they're decreasing the opioid prescriptions or the prescription pills, and as cheap as this stuff is, because cocaine is very expensive, even though they finally made it cheap enough for the average consumer. But compared to the synthetic opioids, cocaine is extremely expensive. I mean, extremely expensive. This stuff is like a nickel's worth, would kill you. So the profits are too high. The amount needed is so small. It's not going anywhere anytime soon. In fact, they're lacing this stuff in other drugs. So I don't know whether they're going to release the 2017 totals of about how many people overdosed and died. I'll have to look it up and see. But if it can't be that much lower than 2016. So say it goes down at 10%, man, and it's at 60,000, you get like 55,000. It's not including the deaths and the overdoses where people get strung out on this stuff. Like I said, it is their modern day plague in America. They'll say, don't ride the white horse, the white horse of death. Anyway, the pale horse. Anyway, folks, that's a short one. This is BGS out, and I will see you guys on the next one.